set of individuals that we have proposed as panel members. And for each level, for instance, if you take district level, we have district head director, we have rep from the regional head directorate, we have rep from the district health committee, or any of the community, we have rep from the traditional authority, and then we have the retired senior health professional or private senior member from the Ghana Health, somebody from the private hospital or private facility. So these are proposed members who are going to serve as evaluation panel to evaluate the awards for the district level. We have put together these panel members so that we will have an involvement of the public, people from the public to be part, people from the community to be part in assessing the nominees to be awarded at the various levels. So for the regional level too, we have rep from the national level, rep from the health directorate. Preferably, we want somebody also from the regional coordinating council, rep from the regional health committee, the media or the community or retired senior health professional or private health sector. We are saying that for each of these levels, the panel should be 5 or 7, depending on the availability of these panel members. And the headquarters too, we have a council member, we have the deputy director general who will also be part, rep from the regional coordinating council, rep from MOH, rep from health partners, and then the private sector also, we have CHAG, media, and then retired senior health professionals. These are the basket of individuals who we have proposed as panel members. Out of it, 5 or 7 can be selected to be panel members who will do the evaluation at the headquarters level. And then at the national level, we have the rep from MOH, rep from GHS Council, Deputy Director General, rep from Health Partners, rep from the media, Director HRD and Director Nursing and Midwifery Service, retired senior health professionals, rep from the private health sector, NGO, rep from CHAG, and then KPMG to serve as the referee for the entire. Thank you.
All right, thank you very much, Mr. Nkuma, for that. So that's the refreshed framework that we are going by. The next is looking at now the nomination process. As Madam Chairperson mentioned, now we've moved a bit to a somewhat digitalized form that we are going to use. We have the nomination forms or the links to the nomination forms have been posted on the Ghana Health Services website. Again, it will be circulated on our various WhatsApp groups and other means or other channels of communication so that everybody would have access to it. So once you access the form, this is the nomination process that we are going to go through. That number one, we always want to have your nomination come through because we don't want a point such that the person was not nominated and has won an award. You know, one of our principles is transparency and accountability. So we don't want that to happen. So a staff can be nominated by their colleagues or by self-nomination. So we encourage as many as possible to nominate yourself. Don't wait for somebody to nominate you. Put in the nomination yourself. And I mean, you know the work that you have done, right? So put in a nomination for yourself. So it can be either ways. Either you are nominating yourself or somebody is nominating you. The nominator is required for each nomination. So, as I said, because as Mr. Nkwan presented, we need to check eligibility. So we want to know that indeed someone has gone through the process. And you must indicate what category you need to verify some of the assertions that are made. So on the back of that, you need to put in a referee on the form so that if there's a need to fact check some of the things that you are putting in there, it's much easier to do that. And on our principles of equity, yes, we know that we are moving to a digital phase. However, we recognize that there could be instances where somebody will not genuinely have access to the, need to take it to the district office for them to now put it in the digital format, so that we're able to track that this is the number, or that we received a nomination from, let's say, Kwesi, and it goes through the system from end to end. So at the district level, that is encouraged. Once that is done and completed, now the digital form will be in the system. Once it's evaluated and we have the winners at the district level, we are saying that some cover letter will be needed at the district level to nominate the people that are moving from the district level to the regional level. So that is also expected to be done. And similarly, at the regional level, once you are moving from the region to the national level, some cover notes will be put on the nomination, so that we know that these are the people that the region has nominated to represent them. We'll go by a strict nomination timeline, and I think Mr. Nkrumah will come and discuss that for the time being. So that will be it for the general staff. For the leadership, just as Mr. Nkrumah mentioned, it's restricted to heads of facilities. So if you're a general staff, use the general staff path, because this is just for the leadership, so that that can be augmented with the institutional assessments that would also be done. The process is the same. You'd also pick a form. The form has also been made available available on our website. Pick it and then complete it. Have your referees also in there. For the leadership awards, we want the referees to be members of your management, because as a lead, you work with people that are close to you. So have two of that people represent you as referees. And then the process is the same as we did for the general awards, so I wouldn't want to spend much time. The assessment criteria is this one. How are we going to assess the nominations that are received? The service has agreed on 4 key parameters, which is looking at performance, customer care, innovation, work settings. So these are the 4 broad categories that the service has set as the criteria for assessing the evaluations that are received. And within these 4 broad categories, there are also some subcategories that we'll be looking at. So service, and then also your area of service. If you are in a deprived area, that counts for something. If you remember, one of the objectives that we have for this program is to encourage as many people to move into the deprived areas. So a certain percentage has been allocated also for that process. So this is for the general staff. For the leadership, there are additional 2 points that have been added. Again, sustained leadership, because we don't want a situation where after your tenure, now the facility is not working again. You need to have a plan to sustain the leadership even in the institution. So that is one category that we are looking at for leadership. Performance also comes here, innovation here, customer care, and another new one for leaders is stakeholder engagement, because as a leader, you need to engage as much as possible with your stakeholders to draw in some gains that the service can also use. And we have our work settings, again, length of service and service in deprived area also here. The addition for this year in terms of the assessment, as Mr. Nkrumah mentioned, is that under the performance, a significant amount of the percentage there will be based on your performance appraisal, because Madam Chairperson in her speech mentioned that this is part of the performance management system of the service. It's not separate. So this year, some emphasis will be